Hello and welcome to The Vital Years, the podcast dedicated to helping you live your best, healthiest life in your golden years and beyond. I'm your host, Emily, and today, we're addressing a topic that is absolutely fundamental to staying active, independent, and enjoying life to the fullest as we age: the health of our bones and joints. It's an area where many of us start to notice changes, and perhaps feel a little anxious about the future. Today, we are incredibly fortunate to have a guest with us who possesses a wealth of knowledge and practical experience in this very field. He has spent his career helping people regain mobility and manage pain. And as he himself is navigating this stage of life, he brings a unique and empathetic perspective. Please join me in welcoming Dr. Robert Miller. Dr. Miller, it is a true honor to have you on the show today.
Thank you, Emily. It's a pleasure to be here. This is a topic very close to my heart, both professionally from years in the operating room and clinic, and personally as I experienced some of the natural changes myself. I'm glad we can discuss it.
Dr. Miller, let's get straight to the heart of the matter that concerns so many of our listeners. As people reach their 60s, 70s, and beyond, they often experience increasing stiffness, aches, and sometimes significant pain in their joints. They might worry about not being able to keep up with grandchildren, struggling with stairs, or even simple tasks like opening jars. Could you explain to us, in clear terms, why these issues become more prevalent as we age? And what are the most common conditions that affect our bones and joints in later life?
That's a perfect starting point, Emily, because those concerns about losing mobility and independence are very real and very understandable. Our musculoskeletal system, our bones, joints, muscles, ligaments, and tendons, is incredibly resilient, built to support us throughout life. However, like any complex system used daily for decades, it experiences wear and tear and undergoes natural biological changes over time. One of the most common issues, affecting millions worldwide, is osteoarthritis. You can think of it as the wear and tear arthritis. Our joints are cushioned by a smooth tissue called cartilage. Cartilage allows bones to glide over each other smoothly. As we age, and due to factors like past injuries, genetics, or excess weight, this cartilage can begin to break down, become rough, and even disappear in places. When that happens, the bones start to rub against each other. This friction is what causes the pain, stiffness, swelling, and loss of movement that people experience, often particularly noticeable in the morning or after rest. It commonly affects the knees, hips, spine, and the joints in the hands. The aching pain, the feeling that your joints are grinding, or the inability to bend down easily, these are hallmark signs that can significantly impact daily life and fuel those worries you mentioned. Another major concern, especially for women after menopause but also affecting men, is osteoporosis. This isn't a joint problem itself, but a bone density issue. Throughout our lives, bone is constantly being renewed. Old bone is broken down, and new bone is built. This process slows down with age, and in osteoporosis, the rate of bone breakdown outweighs bone formation. This results in bones becoming weaker, more porous, and brittle. The danger here isn't usually pain from the bones themselves, unless there's a fracture, but the greatly increased risk of fractures from even minor incidents. A trip and fall that someone younger might brush off could result in a hip fracture or a vertebral compression fracture in some any with severe osteoporosis. The fear of a fracture, and the long recovery and potential loss of independence that follows, is a very significant worry for older adults. Less commonly, but still important, are inflammatory conditions like rheumatoid arthritis or gout, which can also affect joints and become more complex to manage with age, often requiring specific medical treatment. But for the majority, it's the combination of osteoarthritis wearing down the joints and osteoporosis weakening the bones that poses the greatest challenge to maintaining mobility and independence as they get older. It's a gradual process, but the cumulative effect can be substantial.
Thank you for explaining that so clearly, Dr. Miller. It really underscores why these issues are so prevalent. Knowing that these changes are occurring, It leads us to the question of what we put into our bodies. Diet is something we have control over. From your perspective, what are the absolute must-have foods for supporting bone and joint health? And conversely, what foods should we be limiting or avoiding because they might actually cause harm or make things worse? This is something I know many listeners are very interested in.
A fantastic and practical question, Emily. Diet is indeed a powerful tool, both for building strong bones earlier in life and for managing inflammation and supporting joint tissue as we age. It's not a cure-all, but it's a vital piece of the puzzle. Let's focus first on the friendly foods, the ones you want to welcome onto your plate regularly. The bedrock of bone health is calcium. It's the primary mineral component of bone. You need adequate calcium intake throughout life, but it becomes even more crucial as you age to minimize bone loss. Excellent sources include dairy products. Milk, yogurt, and cheese are well known for their high calcium content and good absorption. Leafy green vegetables, kale, collard greens, spinach, and broccoli contain calcium, though it can be slightly less absorbed than from dairy. Still, they are nutritional powerhouses. Fortified foods, many plant-based milks, almond, soy, oat, orange juices, and cereals are fortified with calcium. Canned fish with bones, sardines and salmon are surprisingly good sources. However, calcium isn't very useful if your body can't absorb it. That's where vitamin D comes in. Vitamin D is essential for calcium absorption in the gut and helps incorporate it into bone. Our skin produces vitamin D when exposed to sunlight. But this process becomes less efficient with age, and factors like sunscreen use, living in northern latitudes, or simply spending less time outdoors can lead to deficiency. Dietary sources are limited but include fatty fish, salmon, mackerel, tuna. Fortified foods, milk, some cereals, orange juice. Often, particularly for older adults. Vitamin D supplementation is necessary to reach optimal levels for bone health and also for muscle function, which helps prevent falls. Beyond calcium and vitamin D, think about nutrients that combat inflammation and support joint tissue. Omega-3 fatty acids, these are superstars for reducing inflammation, which is a major driver of pain and stiffness in arthritis. Good sources are fatty fish, salmon, tuna, sardines, mackerel, flax seeds, chia seeds, walnuts, and soybean oil. Aim to include these regularly. Antioxidants, vitamins C, E, and other antioxidants found in colorful fruits and vegetables, berries, citrus fruits, bell peppers, carrots. Sweet potatoes help protect joint tissues from damage caused by oxidative stress and inflammation. Vitamin C is also vital for making collagen, a key component of cartilage. Lean protein, crucial for maintaining muscle mass, which supports your joints and helps with mobility. Sources include poultry, fish, beans, lentils, tofu, and nuts. Magnesium and vitamin K. These minerals also play supporting roles in bone metabolism. Magnesium is found in nuts, seeds, whole grains, and leafy greens. Vitamin K is particularly abundant in leafy greens. Now, let's look at the other side, the foods that might be less helpful or even detrimental to your bones and joints, especially when consumed in excess. Excessive sodium, salt. High salt intake can cause your body to excrete more calcium, which is obviously bad for bone density over time. Be mindful of the salt content in processed foods, fast food, and even restaurant meals. Read labels. Excessive added sugars. Diets high in added sugars can contribute to systemic inflammation in the body, potentially worsening joint pain and stiffness. Sugary drinks, candies, pastries, and many processed snacks are major sources. Limiting these is beneficial for overall health and can help manage joint discomfort. Excessive saturated and trans fats. Found in fatty red meats, fried foods, butter, and many processed snacks. These fats can also promote inflammation. Focusing on healthier fats like those found in olive oil, avocados, nuts, and seeds is a better approach. Excessive caffeine and alcohol. very high intake of caffeine might slightly interfere with calcium absorption, though the effect is generally minor if calcium intake is adequate. Heavy alcohol consumption is clearly detrimental to bone density and overall health. Moderation is key for both. Phosphoric acid in sodas. Some research suggests that the phosphoric acid in dark colas, consumed in large quantities, might interfere with calcium balance, particularly if your diet is already low in calcium. Water, milk, or unsweetened tea are much better choices. It's about making conscious, balanced choices most of the time. You don't need to be perfect, but consistently choosing calcium-rich foods, plenty of colorful fruits and vegetables, lean protein, and healthy fats, while limiting processed foods, excessive sugar, and salt, will provide a much better nutritional environment for your bones and joints to thrive. For someone worried about losing their ability to move freely, knowing that simple dietary changes can help preserve that ability is very empowering.
That's such a practical breakdown, Dr. Miller. It makes sense that feeding our bodies the right way would support our structural system. Now let's turn our attention to prevention, particularly for those listeners who might be in their 40s, 50s, or even early 60s, who haven't yet experienced significant bone or joint problems, but worry about them developing later. What proactive steps can someone take now to build resilience and reduce their risk of severe issues down the line? How can they invest in their future mobility?
Excellent point, Emily. Prevention is truly where we can make the biggest impact. It's never too late to start, but the earlier you implement healthy habits, the better positioned you'll be to maintain strong bones and healthy joints as you age. Think of it as building up your reserves. The cornerstone of prevention, alongside diet, is exercise. And I want to emphasize that it's not about strenuous activity, it's about consistent, appropriate movement. Weight-bearing exercise, these are activities where your body works against gravity, stimulating bone growth and increasing bone density. This is absolutely vital for preventing osteoporosis. Examples include walking, jogging, if your joints can handle it, hiking, dancing, climbing stairs, and even gardening. Aim for at least 30 minutes of moderate intensity weight-bearing exercise most days of the week. If someone is worried about brittle bones and fractures, the simple act of walking regularly is a powerful preventive measure they can take. Muscle strengthening exercise, building and maintaining strong muscles around your joints provides support, stability, and protection. Strong muscles help absorb shock and reduce the load on cartilage. Activities like lifting light weights, using resistance bands, bodyweight exercises, like squats assisted by a chair, or push-ups against a wall, or even using weight machines at a gym are beneficial. Stronger muscles also improve balance and coordination, significantly reducing the risk of falls, which, as we discussed, are a major cause of serious fractures in older adults. This directly addresses the fear of falling and breaking a bone. Flexibility and balance exercises, activities like stretching, yoga, or Tai Chi are excellent for improving flexibility, range of motion, and balance. Maintaining flexibility helps prevent stiffness and keeps you mobile. Good balance reduces the risk of falls. These are particularly important as people get older to maintain agility and confidence in movement. When starting an exercise program, especially if you've been inactive, begin slowly and gradually increase intensity and duration. If you have any existing health conditions or joint concerns, talk to your doctor first or consider consulting with a physical therapist who can help you design a safe and effective program tailored to your needs. Don't let the fear of injury stop you. Smart. Gradual exercise is preventative, not harmful. For those in their 40s or 50s, establishing a regular exercise routine now is one of the best investments they can make in their future mobility. Beyond diet and exercise, maintaining a healthy body weight is absolutely crucial for joint health, especially for the hips and knees. Every extra pound you carry increases the load on these weight-bearing joints, accelerating cartilage wear and increasing the risk of osteoarthritis. Losing even a small amount of weight if you are overweight can significantly reduce stress on your joints and potentially delay the onset or reduce the severity of pain. It's a direct way to lighten the load on your future self. Other preventative lifestyle factors include not smoking. Smoking has a devastating effect on bone density and increases fracture risk.
That's very comprehensive and empowering, Dr. Miller. It highlights that while aging is a natural process, severe decline in bone and joint health isn't necessarily inevitable. We can actively work to mitigate it. You touched on supplements briefly earlier. Many people, as they get older, start taking supplements like calcium, vitamin D, glucosamine, or chondroitin, often on the advice of friends or what they read online. What's your professional opinion on the role of supplements in preventing or managing bone and joint problems in the elderly?
Yes, the world of supplements can be quite confusing, and it's definitely an area where I advise caution and informed decisions. While supplements can play a supportive role for some individuals, they are not a substitute for a healthy diet, exercise, and appropriate medical care. Regarding the key players, calcium and vitamin D, as we discussed, these are fundamental. If your dietary intake of calcium is consistently low, or if you have insufficient sun exposure and blood tests show low vitamin D levels, supplementation is often recommended by doctors. It's crucial to get the dose right. Too much calcium can have risks, like kidney stones or potential cardiovascular issues. So it's best to determine your needs based on your diet and potentially blood work, and always discuss it with your doctor. For many older adults, particularly women, vitamin D supplementation is almost standard practice due to its importance for bone health and fall prevention and the difficulty in obtaining enough from diet and sun alone. This directly addresses the need many feel for these specific nutrients. Glucosamine and chondroitin. These are widely used for osteoarthritis pain. They are components of cartilage, and the theory is they might help repair or maintain cartilage. However, the scientific evidence is mixed. Some large studies have shown little to no benefit, while others suggest a modest effect on pain relief for some people, particularly those with mild to moderate knee osteoarthritis. They do not appear to rebuild cartilage or reverse the condition. They are generally considered safe for most people, but they can interact with certain medications, like blood thinners. My advice to patients is often that they can try them if they wish, acknowledging that the evidence is not strong, and they should continue with other proven management strategies like exercise and weight management. Don't spend a fortune expecting a miracle. For someone seeking relief, offering this nuanced view is important, acknowledging potential but managing expectations. Omega-3 fatty acids, as discussed under diet. These have anti-inflammatory properties. If you don't eat fatty fish regularly, an omega-3 supplement, fish oil, krill oil, or algal oil for vegetarians, might help reduce inflammation and associated joint pain for some individuals. The evidence is stronger for inflammatory conditions like rheumatoid arthritis, but it can also potentially help with the inflammatory component of osteoarthritis. Other supplements, you'll see many others marketed for joint health: MSM, hyaluronic acid, collagen, various herbal extracts. The scientific evidence supporting their effectiveness for osteoarthritis or osteoporosis prevention/treatment is generally weak or lacking. It's essential to be critical of marketing claims. My overall stance on supplements for bone and joint health, especially for older adults, is prioritize diet and lifestyle. Supplements are meant to supplement, not replace, the benefits of a healthy diet, regular exercise, and maintaining a healthy weight. These lifestyle factors have the strongest evidence base. Consult your doctor. Always discuss any supplements you are considering taking with your doctor. They can help assess if you need a supplement, the appropriate dose, potential interactions with your medications, and monitor for any side effects or toxicity. For example, vitamin D and calcium needs are individual. Be evidence-based. Stick to supplements with some level of scientific evidence supporting their use for your specific condition, and understand their limitations. Don't waste money on unproven remedies. For someone worried about future issues, ensuring adequate intake of calcium and vitamin D, ideally through diet and judicious supplementation if needed, is the most evidence-based supplement strategy for bone health. For managing existing joint pain, omega-3s might offer some benefit alongside other treatments. But the message needs to be clear. Supplements are a supportive tool, not the primary solution.
That's very clear and helpful guidance, Dr. Miller. It sounds like starting with the fundamentals, diet and exercise, and then discussing potential supplementation with your doctor is the most responsible approach. Finally, Dr. Miller, let's address some of the deeper anxieties our listeners might harbor. If someone is experiencing pain or stiffness, how can they distinguish between what might be considered normal, age-related changes and something more serious that requires medical attention? And for those who are already living with significant bone or joint pain, perhaps feeling discouraged or fearing that things will only get worse, what message of hope, practical advice, or perspective can you offer them? The thought of being in constant pain or losing the ability to do things they love is a very heavy burden.
This is a crucial point, Emily, because living with that uncertainty and fear can be very difficult. It's true that a certain amount of stiffness, especially upon waking or after sitting for a while, can become more common with age as tissues lose some elasticity. However, persistent pain that is present throughout the day, pain that is worsening, pain that significantly limits your ability to do daily activities, like walking, dressing, or climbing stairs, pain that disrupts your sleep, or pain accompanied by swelling, redness, warmth, or joint deformity, these are not just normal aging. These are signs that something needs medical evaluation. Think of pain as your body's alarm system. Occasional stiffness might be like a gentle reminder, but persistent, impactful pain is a loud alarm that shouldn't be ignored. Many people hesitate to see a doctor because they think it's just old age, or they don't want to be a bother. But early diagnosis of conditions like osteoarthritis or inflammatory arthritis allows for earlier, more effective interventions that can slow progression, manage pain, and preserve function. Don't minimize your symptoms or wait until the pain is unbearable, or you've already significantly lost mobility. For someone living with this worry, knowing when to seek help is paramount. Now, for those who are already dealing with significant bone or joint pain, perhaps feeling discouraged or overwhelmed, I want to offer a message of hope and emphasize that things do not have to inevitably get worse, and management is possible. While we can't always reverse the damage that has occurred, we have many effective strategies to manage symptoms, maintain function, and improve quality of life. Here's what we focus on. Accurate diagnosis, first and foremost. Understand exactly what is causing your pain. Is it osteoarthritis, an inflammatory condition, something else? A proper diagnosis from your doctor is the foundation of an effective management plan. Pain management strategies. This is often a combination approach. It might involve appropriate use of pain medications, over-the-counter or prescription, but also non-pharmacological methods. Physical therapy. I cannot emphasize the importance of physical therapy enough. A skilled physical therapist can provide targeted exercises to strengthen supporting muscles, improve flexibility, reduce stiffness, and teach you better ways to move to minimize pain and strain on your joints. They can help you regain function you thought was lost. This is a direct way to combat the fear of losing mobility. Weight management. Even if you have significant pain, losing even a small amount of excess weight can dramatically reduce the load on your weight-bearing joints and significantly decrease pain. It's challenging, but the benefits are substantial. Assistive devices. Using tools like canes, walkers, braces, or adaptive equipment for daily tasks is not a sign of giving up. It's a smart strategy to maintain independence, reduce pain, and prevent falls. Embrace these tools if they help you live more comfortably and safely. Injections. For some types of joint pain, injections like corticosteroids to reduce inflammation or hyaluronic acid to provide lubrication can offer temporary but significant pain relief. Creating a window for physical therapy to be more effective. Lifestyle adjustments, modifying activities, taking breaks, using heat or cold packs. Using ergonomic tools, small adjustments can make a big difference in managing pain throughout the day. Surgical options. For severe osteoarthritis that significantly impacts quality of life and hasn't responded to other treatments. Joint replacement surgery, hip or knee replacement, is a highly successful procedure that can relieve pain and restore function, allowing many people to return to activities they had to give up. While it's a serious decision, the outcomes for carefully selected patients are often excellent. This offers a tangible solution for severe cases, alleviating the fear of permanent disability. Mental and emotional well-being. Living with chronic pain can be emotionally draining. It's important to acknowledge these feelings and seek support if needed, whether from support groups, friends, family, or a mental health professional. Managing stress can also help manage pain levels. The message is one of active management. You are not helpless in the face of bone and joint problems. There are strategies, therapies, and medical interventions available to help you manage your pain, maintain as much function as possible, and continue to engage with life. It requires working closely with your healthcare team, being open to different approaches, and being patient with the process. Focus on what you can do, celebrate small victories, and know that the goal is to maximize your comfort, independence, and quality of life, regardless of your diagnosis. Don't let fear paralyze you. Let it motivate you to seek help and explore the options available. For someone feeling overwhelmed and hopeless, hearing this detailed list of potential interventions and the emphasis on management and regaining function can shift their perspective from despair to a proactive approach.
Thank you for outlining those pathways to managing pain and maintaining independence. It offers a great deal of hope for those who are struggling. Dr. Miller, as we come to the end of our conversation, if you could leave our listeners with one key takeaway, something practical or encouraging that they can carry with them today regarding their bone and joint health, what would that message be?
My final message is simple. Be proactive about your bone and joint health at every stage of life. Don't wait for severe pain or a fall to start paying attention. Incorporate bone-friendly foods into your diet. Find forms of exercise you enjoy and can stick with. Maintain a healthy weight, and don't hesitate to talk to your doctor about any concerns, no matter how small they might seem. Your mobility is precious. It allows you to connect with loved ones, pursue your passions, and maintain your independence. Taking consistent, positive steps today is the best way to protect that freedom for tomorrow. You are empowered to make a difference in your own musculoskeletal health.
Thank you again for sharing your invaluable insights and for offering such practical advice and genuine encouragement to our listeners.
My pleasure, Emily. I hope this conversation serves as a useful guide and motivator.
And thank you, our wonderful listeners, for joining us for this vital discussion on bone and joint health. We hope you feel more informed, less worried, and empowered to take active steps to support your body's foundation. Remember, taking care of yourself allows you to continue living the life you love. Join us next time on The Vital Years.